this is right before my surgery, and as you could see, I mean, that is a huge difference. I mean, you see a little bit of a deviation right there, but let's look at one where there's no deviation whatsoever. So
Mhm.
obviously, now this is during the time where boys hit their growth spurt, so
So
my
when
maxilla
you
is.
say when you say you're seeing a deviation in that photo,
Mhm.
what are you seeing? That the nose is actually crooked?
Right, yeah. Take a look. I mean, pretty
Mhm.
significantly.
Hang tight. Hold that there. I'm gonna just key you in so that we can see that a little better.
Okay.
I see. Now that's a lot better. That's a much better view.
As
Yeah, it would
compared
help if we,
to.
as compared to there. Yeah, I would say noticeably better looking as a younger boy as well.
Right? Yeah. Yeah,
Like,
definitely
uh,
more symmetrical.
yeah, you're starting to get a little bit of that adenoid face type aesthetic as you go into your adolescence.
Right.
How old are you in that photo? 12, 13?
I believe 12.
Okay. Okay.
Yeah. So I pretty much look like that all the way up into my first surgery. So that's a little closer to the time that I had the first rhinoplasty. And
Hang tight. Hold that
obviously,
right. Put that
sure.
photo back up, Jesse.
So this is more like 15, 16.
Okay. 90s kid, huh?
Oh God. Yeah, I look like I'd listen to POD or something.
Haha,
Yeah,
love that.
um so yeah, I was definitely a child of the 90s. So um leading up to the surgery itself, obviously my concern, because I got made fun of a lot about my facial features as a kid. I wasn't getting attention from the girls that I liked, and often, sometimes got ridiculed by them. And I was treated a little differently, so uh, the the insecurity that it embedded, was a lot stronger than the concern was to open my airway. I mean, I did notice that I couldn't breathe through my nose, but once again, this is pre YouTube, and pre all this information going around from patients to patients, and us being able to figure things out at such a fast rate. Still, the belief is some people breathe through their mouths and some people breathe through their nose. And I mean, the only
Mhm.
thought that I had about it was like, I wonder one day, like, what if I get kidnapped one day and they tape my mouth shut? I'd probably suffocate, right? And that's the only really
Mhm.
intelligible thought I had about my inability to breathe through my nose. So the biggest thing for me was, I see that I have this crooked nose, and I feel like that's the cause of people making fun of me, and it's the cause of my insecurities. I don't want to get it fixed. So that was the biggest motivator, to do it. So I go into the first surgery. Um, Apparently, he's one of the best in Vegas. I go under his knife,
How old were
and
you?
16.
Wow.
Yeah, 16. And so for
What did you
anybody
do it like
watching,
during the summer? The summer between like sophomore and junior year of high school, you did it or something?
basically, yeah, but there's still a lot of time you're gonna miss in school, because it's a brutal procedure. I mean, you could watch one now on YouTube. They cut your nose open right here, there, and lift it. It's an absolutely brutal surgery. The recovery is months long, and you're medicated the whole time. So
Mhm.
it's like, it's crucial for me to warn anybody who's looking at rhinoplasty that, like, there's heavy consequences to this surgery, and it's not a pleasant experience. So I was devastated, months after the surgery, when it was when the nose was going back into its original position. It's just like I had just gone through all this, pain and suffering, and it's pretty heavy on a 16-year-old. I'm missing school. I'm getting behind in my classes, and and just to have the whole thing fail. So
And
we
when
were
you say it
persistent.
failed, what do you mean it failed?
Basically, like, at first, I could notice a marked improvement in my nasal breathing, but the nose went right back to its original position, almost like I had never had the surgery at all.
Wow.
And it did
It
not take long.
re-deviated?
That's correct. It redeviated, not even months, man. I mean, it happened fast. So, I mean, that's devastating, to have, because you anytime you suffer, you think you're going to come out on the other end of that suffering with something to show for it, and when you don't, it hits hard, especially for a 16-year-old kid. So,
Mhm.
I think this was probably after that first surgery.
Mhm. Mhm.
No improvement.
Any
So we
orthodontics at up to that point?
Yeah, actually, yes. Right after this photo, and that's just another factor. I realize that this story has a lot of different factors to it, but right after this photo was taken, I got braces, to fix those, fang-like crooked teeth.
Mhm.
So I'll get back to that after the second surgery. So after the first surgery fail, a few months later, we talked to a different surgeon who's he's another one of the best in Vegas. So he's really confident that he can fix it. So I go under his knife, and this time, what he did was he carved away at a protruding bone right here that basically makes the nose look more crooked, more deviated. And so even though after the surgery, you know, the nose goes back to its original position, but at least this time there is like an aesthetic improvement. This time there's a cosmetic improvement. At least there was that. But at
Let
this
me
point, I'm
pause here
really
for a second, Jesse. Let me
Mhm.
pause here. So you did this all in Vegas. Rhinoplasty is generally considered a cosmetic procedure. You know, when a celebrity gets a nose job, that nose job is formally called a rhinoplasty. Am I correct about that?
That's more of a septoplasty, like
Uh,
a correction of like the cartilage and stuff, like removal of humps. I believe that's, I could be incorrect
that
about that, but there's rhinoplasties and there's septoplasties, and they're typically done in the same procedure. Like a
okay.
rhinoplasty, I believe, is like, yeah, an attempted straightening of the nose, whereas a
Right.
septoplasty is a reshaping. So
I
the
see.
first one was,
Okay.
yeah, so the first one was a rhinoplasty. The second one was more of a rhinoplasty plus septoplasty.
So were the
So
surgeons? Las Vegas is probably a place where a lot of people get a lot of nose jobs, sort of like L.A. or
right.
right, because there's a lot of performers in Vegas, a lot of people trying to look their best in Vegas. There's
Hmm.
a lot of showbiz. So
Absolutely.
the surgeons you saw were probably doing tons of these nose jobs,
Hmm.
um, and so um, theoretically, they should have had a lot of experience. I guess what I'm wondering is, were they trying to do this purely as this was a functional and aesthetic procedure all at once, right? It was never purely one or the other. Is that right?
Correct, but of course, as because my mom's a nurse, so she told me like, hey, when we go in here, when we talk to these doctors, don't emphasize whatsoever that it's a cosmetic thing. Just make sure that the first priority is the fact that you cannot breathe through your nose, and you want to be
Hmm.
able to breathe through your nose. So yeah,
Right.
so going into it, these surgeons were well aware that they were going to be fixing an airway issue, and the icing on the cake of that would be that I'd have a more straight nose.
Hmm.
So
Hmm.
this was
Yeah. Get
after
us
the
back on
second.
track.
Okay, so
Get
this
us
is
back
after
on track. So
this.
you did the second procedure.
Mhm. So, getting back on track, second procedure. This is after the second procedure.
Hang tight.
Uh, uh,
Let me put that in focus.
mhm.
Okay. The
So
nose looks straight.
pretty remarkable improvement, right?
Hmm.
And that was after the nose had gone back, into its crooked position, you know, but that that protruding bump was taken down. So that's what you're seeing in this picture is there's like a protrusion of the bone, going to the
Mhm.
right side of my face that was carved down.
Mhm.
And the ending result was that. So cosmetically, a great outcome. However, years later, I still can't breathe through my nose, and it's not until now. It's not until your content that I've been watching and the Stephen Parks video